Good morning, everyone. My name is Dino, and I'll be talking about dependent personality disorder. Right? So, the list of topics would be the presentation of the case analysis, differential diagnosis, and the etiology and intervention. Right? So, let's talk about the case study. It's all about Jim, a 56-year-old man who is living with his mother for all his life, except when he attended the military service, okay, for 6 years. But then after he was injured, he came back home and stayed with his mother, and all activities was structured by his mother. That is why when his mother got sick, no, he was depressed, and he indicated that he do not know what to do. All right, and at some point he fell in love with a woman, but then his mother disapproved of this woman. Okay, so instead of choosing the woman he loved, he instead chose to stay with her, with his mother. Okay, because because of his fear of abandonment. All right, that he would be abandoned by his mother. Right. Now let's take a look at the diagnostic criteria for DPD. Okay, so it's all about dependent personality disorder is characterized by a pervasive and excessive need to be taken care of that leads to submissive and clinging behavior and fears of separation. Okay? Now, individuals with DPD sometimes agree with other people when their own opinions differ so as not to be rejected. So, their desire to obtain and maintain supportive and nurturant relationships may lead to their other behavioral characteristics, including submissiveness, timidity, and passivity. Okay, so using the case of Jim, he is diagnosed with DPD because he manifested at least five um, criteria criteria. No? Number one, he has difficulty making everyday decisions without an excessive amount of advice and reassurance from others. So this is characterized by his inability to decide on his own. So he still needs to follow the structured world imposed by his mother. Okay. Number two, he needs others to assume responsibility for most major areas of his life. This is characterized by his inability to be the driver of his own life. His life is mainly dependent on the structures or schedules that is established by his mother and the military camp that he attended. Okay. Third, he also has difficulties in expressing disagreement with others because of fear of loss of support and or approval. So this is manifested in his inability to fight for the love of his life. Instead of fighting for it, he chose to let go because he was afraid that his mother will leave him. In the case presented, it was mentioned that choosing between his mother and his lover is a traumatic experience, and in the end, he chose to let go of the relationship instead of, he let go of the relationship and stayed with his mother. Four, he also feels uncomfortable or helpless when alone because of exaggerated fears of being unable to take care of himself. This is manifested when his mother was hospitalized. He seemed helpless because he does not know what to do. It was mentioned in the case that due to his mother's illness, he showed his inability to cope or he seemed helpless because he does not know what to do. His mother's illness meant that his structured world might crumble. Okay? He is also unrealistically preoccupied with fears of being left to take care of himself. So this is manifested by his fear of losing his mother. And on the case, it was mentioned that he was distraught and depressed over his mother's condition. Right? Now, for the differential diagnosis, number one is the other mental disorders and medical conditions. So, DPD must be distinguished from dependency arising as a consequence of other mental disorders like depressive disorders. Okay? And of course, as a result of other medical conditions. Second is other personality disorders and personality traits. We have here borderline personality, borderline personality disorder. Okay, so both dependent personality disorder and borderline personality disorder are characterized by fear of abandonment. Okay, however, the individual with borderline PD reacts to abandonment with feelings of emotional emptiness, rage, and demands. Okay, now for histrionic PD, individuals with histrionic PD, like those with dependent personality disorder, they have a strong need for reassurance and approval, and this may appear childlike and clinging. However, histrionic PD is characterized by active demands for attention. Okay, and lastly, the avoidant PD. Both DPD and avoidant PD are characterized by feelings of inadequacy, hypersensitivity, sorry, to criticism, and a need for reassurance. However, individuals with avoidant PD have such a strong fear of humiliation and rejection that they withdraw until they are certain they will be accepted. Okay? Now, personality change due to another medical condition as well. No, so DPD must be distinguished from personality change due to another medical condition. Excuse me. And lastly, substance use disorder. Right. So DPD also must be distinguished from symptoms that may develop in association with persistent substance use. Okay. Now let's talk about the etiology. Um, Mental health experts haven't figured out what causes DPD, but they believed it results from a mix of genetics, environment, and development. Okay, so experts have found DPD is more likely in people with particular experiences, including parenting styles. Okay, authoritarian parenting may create dependency, and of course, also overprotective parenting can also lead to high levels of dependency. Right. Second would be early childhood experiences. Many ideas have been developed about the etiology of DPD. Early studies of dependent personality traits were looked at psychoanalytically. Okay? So these traits were associated with breastfeeding and weaning. So we'll know that those who became fixated at the oral stage would remain dependent on others for support. So it was thought that high levels of dependency came from either frustration or over gratification during the oral stage. Okay? And family history would play as well. Someone with a family member who has DPD or another anxiety disorder may be more likely to have a DPD diagnosis. Okay, and lastly, the certain cultural and religious or family behaviors that some people may develop DPD due to cultural or religious practices that emphasize reliance on authority. Okay, and lastly, for the interventions, we have here psychotherapy, social skills training, cognitive behavioral therapy, psychodynamic therapy, and medications. Okay, the goal of these therapies is, of course, to um, develop independence within the individual. Okay, so madaming therapy na pwedeng gamitin, these psychotherapies, CBT, psychodynamic therapy. Iba-iba lang ang pangalan, but majority of this we are using it to lessen the dependence of an individual to their loved ones or someone in with authority. Okay, and this medication is a last resort if it's not treated by therapies. Medications is the last resort. These medications would, of course, to lessen the anxiety of an individual. Okay, so that ends my discussion, These are my references. Thank you and